Let's move to the lumbar spine. Lower back problems are an exceptionally common issue. I guarantee you will encounter more than one client with complaints of lower back pain in your career. There are many low back conditions, and you should always make sure your client has a diagnosis from a medical doctor outlining what they can and cannot do. The most common lower back injury is the lumbar muscle strain or sprain. With this injury, pain is isolated to the musculature and does not radiate down the buttocks or leg. Muscle spasms are common and are the body's natural protective mechanism, a natural brace to limit movement that could cause further injury. These symptoms can be brought on by lifting incorrectly, causing an acute muscle strain, most commonly while the spine is in flexion and rotation. Lifting incorrectly over a period of time, poor body mechanics, weak abdominal and or lower back muscles or a weak core, and tight hamstring or lower back muscles. Immediate treatment is to apply ice, not heat. Heat may feel good initially, but can amplify symptoms later. The ice will aid in decreasing pain and spasm with a longer lasting effect. Begin pain-free stretching in the opposite direction the injury occurred. If the injury occurred in spinal flexion, press-ups should be performed, and if it occurred in extension, knee to chest progressions are taught. Avoid prolonged positions. Pain is usually a good indicator that it's time to change positions. Follow the 5 rules of body mechanics. They're outlined in detail in your module. After acute symptoms resolve, spinal stabilization exercises in a neutral spine position should be performed on a regular basis. If the cause of the injury is not corrected, recurrent low back pain will likely continue. Let's review some basic spinal anatomy before focusing on the topic of a herniated lumbar disc. Intervertebral discs are fibrocartilaginous discs located between the cervical, thoracic, and lumbar vertebrae. Their function is shock absorption for the spinal column and to maintain space between each vertebrae. The spinal nerves are an extension of the spinal cord and exit between each vertebrae. One method of evaluating referred nerve symptoms is by performing a dermatome examination. A dermatome is a segment of skin innervated by a spinal nerve. For example, the dermatome for the L5 nerve is the lateral lower leg and the top of the foot, and the dermatome for the C8 nerve is the medial forearm and 4th and 5th fingers. Consequently, complaints of nerve symptoms can be traced from the dermatome back to the exact herniated disc pressing on the nerve. A herniated lumbar disc should not be referred to as a slipped disc, but rather a herniation or a bulge. The most common disc herniation is at the L4-L5 space, where the sciatic nerve exits. The herniation impinges the sciatic nerve, and nerve symptoms are felt into the buttocks and down the leg. This is known as sciatica, or inflammation of the sciatic nerve. Referred nerve pain into the buttocks, thigh, and possibly into the lower leg or foot can be described as radiating, burning, shooting, tingling, or numbing. It's important to remember that central low back pain may cease while referred symptoms into the buttocks or leg persist. Each of these images exhibit a different view of a herniated disc pressing on the nerve. Continued symptoms of a herniated disc may include muscle spasm, a shifted torso, a positive straight leg raise test, and weakness of the muscle due to restricted innervation by the pinched nerves. The causes are the same as for a low back muscle strain. The straight leg raise test for sciatica is positive if nerve symptoms down the leg are reproduced. Treatment is the same as for a lower back muscle strain, but extended treatment depends on the number and level of discs involved, as well as the size of the herniation. An MRI or CAT scan is often ordered to confirm the diagnosis and determine the severity. A portable TENS unit may be worn to decrease pain while performing rehabilitation exercises or activities of daily living.